What's up, everybody? Dr. Bonzo back again with a quick addendum to my last video I did on gout. I'm on my lunch break right now. Hope everybody had a happy Thanksgiving, by the way. But yeah, on my lunch break, and just happened to read the newest article in the American Family Physician Journal and saw an update on gout. So I wanted to, I read through the article and wanted to make a quick comment about urate-lowering therapy. So if you remember from my last video, I said that the indications for urate-lowering therapy with one of those xanthine oxidase inhibitors for people who have gout are if you have multiple gout flares in a year, if you have urate kidney stones or uric acid kidney stones, also if you have tophus, one of those lumps that you get from gout, or if you have any kind of form of joint destruction, and then finally if you have chronic kidney disease. If you have any of those situations, they recommend uric acid lowering therapy because the risk in terms of kidney damage, in terms of joint destruction is so high that the benefits start to outweigh the risk. Now, I said that in the last video, but some addendums that I forgot to mention that this article reminded me of are, number one, is that they've actually done some head-to-head trials, and it turns out that out of the two options that we currently have in the US for urate-lowering therapy, Allopurinol and Uloric, the guidelines actually now recommend Allopurinol as first line because there's actually, for Uloric, which is febuxostat, there's actually an increase in all-cause mortality for people who take that medicine. So for whatever reason, they're more likely to die when they're taking that medicine compared to Allopurinol. Not to mention the fact that Allopurinol has been on the market forever and is super cheap. So when you're doing your uric acid lowering therapy, make sure you use Allopurinol as your first line. Obviously, if somebody's had a reaction to it or is not able to tolerate it, then you can think about using Uloric. The second thing that it reminded me of is that whenever you start somebody on urate lowering therapy, I think I forgot to mention this in my last video, but they are at a slightly increased risk of having a gout flare during that time. So you actually should put them on prophylaxis while they're on those medications for the first 6 months they're on them. So in that situation, you can use colchicine once daily along with their Allopurinol, for example. And of course, colchicine is a much lower risk medicine than having somebody on chronic steroids for 6 months. So again, reminder that during those first 6 months, colchicine along with their Allopurinol or uric acid lowering therapy while you're starting people on meds. And again, Allopurinol is preferred over febuxostat. All right, thanks for letting me add that addendum. I'll post some other videos sometime soon. All right, take care.